Welcome back. It is 7:23 now on a Tuesday morning. Wet out there. Indiana hospitals are fully open for business. Labs, screenings, and prevention, all of that's happening. But some Hoosiers have been neglecting their health because they're fearful that they could come down with coronavirus. So many doctors are now reaching out to their patients to reassure them that it is safe to see them. And you need to. Joining me now is Dr. Julia Compton. She is the CEO of Hancock Physician Network. Doctor, thanks for checking in from Greenfield this morning here. This is a message that we've talked about, but really bears repeating here. Tell us the situation that you're finding with patients at this point in time.
Absolutely. Thank you for having me. So initially we were hearing that people were very, very afraid to come to the doctor. And that's something that we are very aware of as well. It's scary out there, but we also know that people have a lot of health conditions and we really want to take care of our community. So we've put a lot of steps and measures in place to keep people safe. And I think that's a little bit different in how we're seeing and experiencing healthcare today. But our hope is that that makes people feel better, makes us feel better, and allows us to deliver care in the best way possible.
You know, sometimes it's in the specifics here. Are there things that you're doing that you can share with folks who are watching right now? What are you doing to actually guarantee that the contact is as minimal as possible when you're going to something like a doctor's office?
Yeah, absolutely. So the very first thing we're doing is waiting rooms. So waiting rooms are really no longer something we have any longer. So when people come to the doctor, the very first thing that happens is they pull up to the parking lot in their car and we initiate the visit in the car. So understanding going through those screening metrics to make sure they don't have any symptoms, to keep them safe and the office safe, and then starting to hear what brings them to the doctor, and all while they're sitting in their car.
Well, let's talk about the two extremes. You know,
Sure.
Not every medical condition requires a trip to the doctor. I mean, I'm going to ask you to speak in general terms here, but when is that the situation? Then on the other side of the coin, you know, somebody needs to be hospitalized. How do you handle those two scenarios?
Right. So like most healthcare organizations out there, we're utilizing the virtual visit, the ability to be able to have the first visit, the phone call, or the video call on your phone with your doctor. That gives us a very good idea of what level of care is needed. So at that point in time, you know, we're able to decide, do we need to see you in real life? And if the answer is yes, is that something that can be done in the office? Or is it that your symptoms and your needs are much more urgent and something we need to address in the hospital? So for us and for many in healthcare, it's starting off with that virtual visit and then coming from there, whether it's to the doctor's office or to the hospital itself.
One last quick question here. For parents who have kids that need to go see the pediatrician, can the parents go in with their children or not yet?
Yes, no, definitely. So we have, as parents, all of us, myself included, I want to go. I want to see the pediatrician. I want to be with my child. And so we have a lot of videos and books that we use with our kids right now that we give them a mask. We give the parent a mask. We're trying to limit the number of caregivers that go with them, but absolutely. I mean, you want to make the kiddo feel good and safe and comforted, and the best way to do that is have the parent or caregiver with them.
Yeah, for a lot of times it just wouldn't happen otherwise. Dr. Julia Compton with Hancock Physician Network, thanks for your time and have a great day today.
Absolutely, you too.
All right, it is 7:27, Ange.
All right.